Hello, my name is Jessica Jones and I'm from Indiana. I tend to talk really fast when I'm nervous, so if I do that, just do this to me and I'll slow it down. So I wrote out my story last night. I tried over a month of picking out one thing that I really wanted to directly talk about, and I was discussing it with my husband and I talked about it with my oldest son. And we have so many stories. Everyone in this room, just listening to stories we've heard so far, we have similar stories, and we have stories that are so different, but yet we have so much empathy towards each other because we know we can feel that emotion. So I want to thank those that have gone before me and those that are going to go after me, because you guys are just amazing. So I want to discuss this situation. My husband called me one day in April of 2018 and said, "I lost my job." I laughed at him because I thought he was joking with me. He was definitely playing a late April Fool's joke. I kept telling him, "You're joking. You've been there 10 years. You've been recently promoted. There's no way." We had decent insurance, decent after the ACA had went into effect. No way they had let him go. I just kept accusing him of lying for 10 minutes straight. It took that long for him to finally say, "Jessica, I really lost my job." In 2014, we had just bought a brand new home, purchased a brand new car, took a nice Disney vacation with our kids, and then in October that year, found out our son was sick. This is after myself living with a chronic illness. So now we were not only taking care of me, but we were now taking care of him. Having that, we yearly made our deductible by April, over $7,000 right off the bat. So for him telling me he just lost his job, it was gut-wrenching. I knew we just lost our insurance, and all that money we just paid in was going to restart. We were offered COBRA for $600 a month. He just lost his job. We just spent all of our savings. Where were we going to find that money to pay for COBRA? So I picked up insurance at my work, but because I work for a healthcare organization, their health insurance was networked to them. So my specialists and my son's specialists were out of network. So it was to spend a whole month of trying to get my son into a different specialist, get me into different specialists, or stick it out until my husband found another job with different insurance. He eventually did. However, the insurance was not what we expected. Our deductible with co-insurance and co-pays have cost us over 10 grand. Like I said, we tend to hit this right off the bat every year. So in 2018, last year alone, we had over $30,000 in medical bills. I laid them out across my kitchen floor and added them up. And that is, of course, because we had 3 different deductibles last year. Because my husband lost his job, I picked up insurance shortly until he picked up insurance at the new job. But it doesn't matter. All of us are facing these co-insurances, co-deductibles, and co-pays. We fell into a limbo after last year. Because I work and my husband work, we make over poverty. So despite me trying to get disability for my son, trying to apply for financial assistance, we are consistently told that we do not qualify. But our bank account's empty. We're getting ready to file for disability. We've talked to lawyers about filing for Medicaid divorce, which is similar to Medicare divorce. It was very popular back in the 80s for elderly couples that were trying to get into nursing homes. We had that conversation about Medicaid divorce to try to figure out how to get Medicaid for our son. I have had the conversation with my 10-year-old son, whereas other people have conversations with their children about to be nice and play nicely with your other kids. I'm explaining to him how to prepare and get yourself ready to have a savings account so when he's on his own, he can manage his medical costs. It's not right. I'm scared the day will come when he has to take on this responsibility. There's 2 things that people take for granted in life, and it's time and health. And until the day comes that someone has their health taken from them, they will never truly understand. So I thank the NPAF Foundation for inviting us here today, and I truly hope that we can help the Congress people understand what it truly means to have their health taken from them. Thank you.